Okay, so the last method we're going to talk about is the withdrawal, aka pull-out method. This is more like a lifestyle choice. This is the act of pulling out the penis from the vagina right before ejaculation. It works best if you use it with another contraceptive or barrier method. This is because it must be timed correctly. If semen ends up in the vagina, you could potentially get pregnant. By ejaculating away from the vagina, you can prevent pregnancy, but you do have to time it right and do it every single time. So, what about the pros and cons? Well, pros include the fact that this method is always available. You don't have to go anywhere to buy it, and it's free. There's no side effects or hormones used, and if you use it in addition to other birth controls, it could make them more effective. However, it's really only 78% effective, so if you're really concerned about getting pregnant, this might not be the best choice for you. It's really easy to mess up and definitely requires more experience, self-control, and trust. It also does not protect against STIs, so you'll need to use barrier methods to protect against them. And that wraps up our contraceptives module. In total, we talked about 7 different contraceptives. So let's go over our learning objectives one more time to be able to identify types of contraceptives, starting with IUDs and implants, then shots, rings, patches, pills, and finally withdrawal. We recalled pros and cons of each kind of contraceptive. General pros included regulating, lightening, or stopping periods, and reducing cramps. Cost is usually covered by insurance, and we also talked about how effective each method is, how easy they are to use and remember, and how some have health benefits. For cons, the methods that use hormones have side effects like spotting and bleeding between periods, as well as possible nausea, headaches, and breast pain. But most side effects, if they're experienced, go away in a few months. Also, these contraceptive methods do not protect against STIs. We also learned how to access types of contraceptives through your healthcare provider and how to utilize all of this information to determine which contraceptive method you would use in your life if applicable.